The hamstring stretch is something that is so commonly used for back pain, for general stretching and yoga moves as well. And in this video, we're going to go through 5 things that you need to consider to make your hamstring stretching more effective, particularly looking at it through the lens of doing this to help you with your back pain. Before we get into it, why are the hamstrings potentially important? Well, a lot of people, when they have lower back issues, and we're talking about down the bottom here, so the L4-5, L5-S1 region of the spine, there's going to be some involvement of the hamstrings, be them they've got pain there, they've got tension, they've got spastic contraction in that region, and therefore this, unfortunately, although it comes from the lower back, it has a negative impact on the functionality of the lumbar spine and the healing process. Hamstrings getting tight and stiff mean that the pelvis is pulled around in this direction, and what that does there is puts pressure on these discs on the front, which is not helpful for the healing process. It affects the normal biomechanics of the lumbar spine, which should have a nice smooth curve through it. So we want to make sure we're understanding how to stretch our hamstrings specifically, but also in a way that doesn't affect the lower back. So with that little blurb out of the way, let's get into the very first tip, which is going to be about rounding the lower back. We've all been told to touch our toes to stretch our hamstrings, but what really is happening when we touch our toes, especially if we've got tight hamstrings? Well, let me show you. So when we're stood in a nice upright position, people simply bend from the top and just roll all the way down. That's flexing all of this region of the lumbar spine before we finally get through to the hamstrings. In some cases, the pelvis stays like that completely and it barely pulls on the hamstrings at all. The big problem is this just isn't specific. If we're trying to replace a window in our house, we don't take the whole front side of the building off just so we can replace the window. We might cut out the window and replace it more specifically. And the same thing should be done with our stretching. We don't want to stretch the whole body just to stretch the hamstrings, because there might be certain issues with the other parts of the body that are going to be negatively affected in the pursuit of trying to stretch the hamstrings. So let's be specific and do things properly, because we can. So number 2 follows on very neatly. And this is a non-specific stretch and the problems of that. If we think about lower back issues, most of the time it's got a compressive element to it. It's compression that's caused your back pain, maybe combined with a funny movement of some sort, but it's not stretching. Unless you've been parachuting and got caught in the net and suddenly got a big stretch, which is highly improbable, your onset of lower back pain is led by, or is caused by, the consistent or one-off extreme compression through the lumbar spine. And that's led to injury, which has caused sciatica, disc injury, stenosis, spondylolisthesis, whatever it may be, lots of different conditions. But that compression has an impact on the discs, and they tend to be involved to some degree in that lumbar issue. So if we take those lower lumbar discs, L4-5, L5-S1, because those are so commonly involved, and we forward bend through the lumbar spine, we shift a dramatic amount of pressure onto these structures. But not only that, there's normally an involvement in the lower back of the ligaments and tissues that maintain the lordosis nice and tightly here, that extend through onto the back of the disc. Those ligaments and tendons have been damaged, they've been weakened, they've been torn in some manner, maybe in a minor way, but there's tissue damage there as well, because we can't isolate one of these structures in reality. The body is much more interconnected than that. But as we bend forwards, we pull open all of these little scabs that are trying to knit themselves back together with this very ineffective stretch. And in a lot of people, the lower back issue may not even be causing lower back pain. It may be just sciatic type symptoms in the leg, in the glutes, and further down the body. So when we're doing these sorts of non-specific stretches, we might inadvertently be creating more harm than good in the pursuit of stretching those hamstrings. And the final thing to bear in mind is, although they may feel good whilst you're doing them, because they're opening out the little holes where the nerves come out, this may be even worse because it makes you feel like you're doing the right thing at the time, only to find that the back pain persists and gets worse. And what happens there is there's more damage as a result of doing the wrong sort of stretch. So the signals go down to your hamstrings and tell them to tighten up faster. So you find you have to go back and stretch again sooner. It gets into a vicious cycle. And part of that isn't the topic of this video, but really, should we be doing stretching as our main source of relief at this point in the recovery process? That is something to think about. So now we're on to point number 3, and this is about doing the right sort of things. And the next 2 points will be consequences of doing the right things that you want to watch out for. So point number 3 is about doing the hip hinge. And it's the absence of the inherent natural hip hinge that often leads to the repetitive stress that causes back pain in the first place and an injury down here. The hip hinge is the ability of you to rotate about the hip axis without the lower back being involved. And if we can do that, then we can really influence and stretch the hamstrings effectively without all of those bad things that I just mentioned in point number 2. It's very important to get your head around this. Quite often you'll see someone that can touch their toes completely flat, hands on the floor, and then you get them to do a proper hip hinge, and all of a sudden the hamstrings, oh, that's as far as I can go. I can't go any further because I'm doing the movement properly, my back's not doing the movement, and now I'm actually stretching the hamstrings. Mastering this hip hinge, this ability to maintain a neutral lordosis in the lumbar spine whilst bending about the hips, is something that's so important for lifting, for bending, for moving, for gardening, for all of those different activities. If you can get the hip hinge, not only will it improve your hamstring flexibility and effectiveness when stretching, it's also going to be so much better for the long term for your lower back and for your back pain recovery and rehab long term, or prevention of future injuries, because you're starting to bend correctly rather than weakening the lumbar spine, likely just before you're about to lift something. The thing to bear in mind with the hip hinge is it takes a bit of time and it takes a bit of practice. And you can even start while you're doing a hamstring stretch, maybe seated, by just thinking about your bum going back. Think about this bum driving backwards, and that will affect the hamstring length and therefore lengthen it as that hip moves through into flexion without it affecting the lumbar spine. Conversely, we just pull the top of the spine and pull the bottom of the legs and everything rounds up, and hopefully the hamstrings will be affected as well. And that's just not the way to stretch, especially if we've got a back problem. The next thing to bear in mind, and these next two are really about the consequences of doing it right. When we're stretching properly, we should be feeling a pull in the muscle. We should be feeling that muscle pull. There should be tension in the muscle. That is normal. And the observation that maybe one side is a little bit more than the other, well, that's okay. That's an observation to chalk up and monitor as you go on forwards. The important thing to bear in mind, in addition to that, is that if there is a lower back problem and there's communication from this region of the lumbar spine into those hamstring muscles saying, hey, tighten up, inappropriately so, then yes, you can do your hamstring stretches, but you're going to find that as long as there's a problem here, those hamstrings are not going to respond as well as they should be. And this is all about timing. This is, are we really working so hard on the hamstrings right now when we should be working harder on other things? Because as we start to find that this area heals up nicely, the back problem goes away, you'll actually find that your stretching of the hamstrings is much more efficient and much more long lasting. When we're in the early throes of back pain or sciatica or some sort of disc injury of some description, we'll find that actually the stretching is very, very futile. Although it provides short-term relief, that's okay. It's not going to be a long-term solution. It's not going to help us in the long term. We need to get the back sorted out first so that it stops derailing our stretching protocols. The final one, number 5, is also about muscle tension, but in a different part. Because the hamstrings are so commonly implicated with lower back pain, we often find that when you get people doing a hamstring stretch correctly, there is the requirement to maintain a lordosis, maintain contracture of these muscles, because as the hamstrings start to pull as you go into the movement, the hamstrings, because they attach in on here, they're going to pull in that direction, right? And we have to do something actively to stop that process. So you'll hit like a bite point where, oh, things are starting to engage. The hamstrings have gone through their comfortable range of motion and now they're hitting the stretching point. And that's where the tension in the lower back needs to come in, needs to and can and should come in, because the lower back will maintain that position as the hamstrings start to pull. And what should be happening is the lower back muscles are overpowering the hamstrings and allowing the stretch to continue rather than not engaging the lower back and finding the back just ends up rounding. It's that tension that often throws someone, especially if they've got long-term back pain or are a little bit more concerned about what's going on there, don't understand the situation that's going on in the lumbar spine as well, or it hasn't been explained as well. You can get a bit nervous when you're doing a proper hamstring stretch, going, why am I feeling tension in my lower back? Well, that's okay, because the lower back tension is there helping you do the hamstring stretch properly. And that's a very important concept not to shy away from. It really, really makes the stretch so much more effective by engaging these muscles and allowing the lumbar spine to remain neutral as the hips are going through their necessary flexion range of motion. So here's a nice little bonus tip to help you do your hamstring stretching more effectively. It involves you going into a doorway of some description. Most people have these in the house, or a cabinet of some description in your bedroom maybe, where you've got room to pop one leg up on the side of the doorway or the cabinet and the other leg can go straight through. And that allows you to be in a position whereby the straight leg that goes through the doorway is protecting the lumbar lordosis and helping make sure that we don't just pull the pelvis around like we discussed in point number 1. Whilst also you're in a position where you can relax, you're off weight bearing, you haven't got the added complication of gravity pressing down on your lower back. And that should be something that you can really relax into and enjoy the stretch. When you finish the stretch, maybe you're doing about 30 seconds or so, You then gently come away from the door. Don't move quickly, especially if you've managed to relax into that stretch for the first time. You want to slowly bend your knee, bring your foot back down to the ground level, and then just push yourself away from the door frame or the cupboard, whatever you're using, so that you can nice and slowly roll onto one side and then get yourself up when you're ready. So to round it up, first thing, you should not be rounding your lower back. That is lazy stretching. It's not effective, and if you've got a back problem, you're doing it wrong and you're making things worse. Point number 2 ties in with the rounding of the back, and that's taking an approach of a non-specific stretch. That's taking the head and taking the foot and bringing them together and hoping that somewhere along the way the hamstrings get a stretch as well. It's not helpful, and not only that, it's counterproductive and creates more stress and strain on the tissues, if we're talking about lower back pain, that are trying to recover, repair, and re-establish a better state of function and structure. Point number 3 was about starting to do things correctly, working with a hip hinge so that we're actually using the hamstrings rather than just using gross whole body movement. Mastering that hip hinge, which can take a little bit of time, is really essential to effective hamstring stretching. And that is a very important principle of doing this thing properly. Point number 4 was about it's okay to feel that there is tension in the hamstring. You might notice one is different to the other. And we also talked a little bit about how as you get your back pain resolved, as your back gets rehabilitated properly, the tension disparity, one leg to the other or both legs, if they're really, really tight, will start to be more effectively reduced with your stretching because you're doing the right things rehab-wise to strengthen and support and protect that lower back as it's going through a healing process. And point number 5 was really not worrying about that lower back tension, realizing that to do an effective hip hinge, we need a degree of lower back engagement to maintain the lordosis in the lumbar spine and make sure that the hamstring tightness as it kicks into that bite point doesn't pull that pelvis into a posterior pelvic tuck. So hopefully that all makes sense for you and you've got a better idea of how to effectively stretch your hamstrings going forwards. Hopefully you found this video helpful. If you did, consider giving us a thumbs up, share it with someone else who you know has got very tight hamstrings. Hopefully they can start doing things more correctly and get more luck with stretching the hamstrings and maybe not make their lower back worse in the process of doing so. And also consider subscribing to the channel. We do these sorts of videos to help you with your back pain and all sorts of aspects related to that. If you do find it helpful, if you're subscribed to the channel, you get notified when we post another video. Thanks for watching. If you want to learn more about the premium Back in Shape membership, there's going to be a video somewhere underneath here. And if you want to stay up to date or tune in to some of our more recent live streams and the Q&As at the end of those, then that's going to be down here. And remember, you can subscribe to the channel up here and hit the notification bell to make sure you know when we next go live so you can join us for our next live stream and Q&A.